close contact is based on the CDC guidelines. And what we determine when we interview people is, were they in contact with somebody within 6 feet for 15 minutes or more? And that's with or without a mask, because even when you have a mask on, you're using the best precautions possible. But if you're within 6 feet for that period of time, it's still considered a close contact. And it's not a close contact if you pass someone in the hallway or you happen to have a very brief interaction with somebody who is positive. It's really with that sustained presence, and that's an important thing to understand. Tracing is a team of professionals, primarily nurse practitioners and nurses are the contact tracers. As an individual becomes positive, the contact tracing team is notified. And if it's employees, then that's done in partnership with occupational health. If it's students, then it's done through the contact tracing team that we've stood up on the Vanderbilt University side. And what we do is we interview that individual who became positive and ask them who they were in contact with during their infectious period. And the infectious period is up to 48 hours before the onset of symptoms, or for somebody who is asymptomatic, so they don't have any symptoms, 48 hours before the date that test was done. And we walk through with them a very detailed process about where they were, who they came in contact with. We also spend time talking to that individual because they're going to need to go into isolation. So we spend some time helping them explore what that will look like and what kind of support they're going to need during that isolation period. That individual will identify potential close contacts for us. And then we turn around and subsequently interview those close contacts and talk them through what really happened and were they indeed close contacts. If they were, they're placed in quarantine, and again, we work with them to determine how they can be effective and in quarantine. So do they need support services? Do they have somebody who can bring them groceries? For our students on campus, we have special isolation and quarantine housing for them, and we will take care of all those needs. We will also support and check on those individuals who are in isolation and quarantine. Should they become sick, student health will step in with further interventions as needed.